The supplements you take can either boost your fertility or make it harder for you to get pregnant. Hi guys, Dr. NG here and welcome back to my channel. So today we're going to be discussing the right supplements that a lady needs to take in order to help with getting pregnant and maintaining a healthy pregnancy journey. So if you want to know this, then you have to stick around, okay? So as a lady, the supplements and nutrients that you take are actually vital, okay, for you to get pregnant and have a healthy pregnancy. So those nutrients and vitamins really play a role in fertility. In order for you to get pregnant, there are certain factors that come into play, okay? Having a healthy sperm and a healthy egg is important. Having a patent fallopian tube, okay? Making sure that your fallopian tubes are not blocked is also important. Having the normal structure of the uterus is important, and a good hormonal balance. These play a role in having a healthy pregnancy or achieving a healthy pregnancy. The first supplement that you'll be needing here will be folic acid, which is vitamin B9, okay? So please do not miss out on this supplement if you're trying to get pregnant, before pregnancy, and even during pregnancy, okay? So this supplement does a lot with, the baby's development. So it could help to prevent birth defects from developing in the early stages of pregnancy. So it is recommended for one to take about 400 micrograms of folic acid before pregnancy and up until 12 weeks of the pregnancy, okay? So, folic acid is very important. Like I said earlier, it prevents birth defects. It prevents your baby from having neural tube defects like spina bifida, which is basically when the spine and the spinal cord do not develop well or develop abnormally during pregnancy or while the baby is in the womb, okay? So folic acid plays an important role. And a higher dose may be required sometimes, okay, for certain persons that would be taking folic acid if they fall under a certain category, which I'm going to be discussing here. So people that would be requiring a higher dose of folic acid would take about 5 milligrams of folic acid before pregnancy till about 12 weeks of pregnancy. And this category of people would include people that have had previous pregnancies of NTDs. You've had a previous baby that had a neural tube defect. So in this current pregnancy, or when you're trying to get pregnant again, you should take about 5 milligrams of folic acid. The second people under this category would be people with a family history of NTD. So if you, as the lady, or your male partner have a family history of neural tube defects, the lady would definitely be taking 5 milligrams of folic acid. The third people on this list would be people that have diabetes, okay? The next one would be people that are taking anti-epileptic medications, okay? Then the last people on this category would be people that are on antiretroviral medications. If you've been taking some antiretroviral medications for HIV, you would definitely be needing a higher dose of folic acid. So people that fall under any of this category should definitely discuss with their OBGYN, to make the right dose of folic acid that you'll be needing before pregnancy and during pregnancy. The next important supplement that you'll be needing would be fesolate, which is iron, okay? So, iron is very essential for producing red blood cells that carry oxygen in the blood, okay? And, when someone is deficient in iron, the person is likely to come down with iron deficiency anemia. So iron is very important when you're trying to get pregnant and also when you're pregnant, because it would help to reduce having babies with low birth weight and also prevent you as the mother from suffering from maternal iron deficiency anemia. Aside from taking iron supplements, diets that are rich in iron would also play an important role here, okay? Diets like red meat, fish, green leafy vegetables, dry nuts, milk. So these diets are important. But, vegetarians, who are people that don't take meat or dairy products, might not get, enough quantity of iron from their diet. So these people would definitely need to take iron supplements when they're trying to get pregnant and also during pregnancy too. The next important supplement here would be vitamin D, okay? So it is recommended for you to take about 10 micrograms of vitamin D, okay, when you're pregnant, okay? And vitamin D plays an important role because it helps to regulate calcium and phosphate levels in the body, which are very important for building your baby's bones and teeth. So if you do not take vitamin D supplements, okay, when you're pregnant, it would increase the risk of having babies that have soft bones, leading to a condition known as rickets that affects bone development in babies. Sources of vitamin D would be, exposure to sunlight, foods like the oily fish, the sardines, mackerel, salmon, the egg yolk, and other diets like that. The body produces vitamin D when you're exposed to sunlight, but there are certain people that may not produce enough vitamin D, and these people would include people that are always indoors, not exposed to sunlight, people that always cover up their skin, people that are dark skinned too, and people that have a BMI of more than 30. So this category of persons may not produce enough vitamin D in their bodies, okay? So it's important for you to take the vitamin D supplements. The recommended dose, like I said earlier, is 10 micrograms, okay? So please do not take more than 100 micrograms because it will definitely be harmful to your baby. So, excess of everything is definitely bad. So it is best for you to stick to the recommended dose of vitamin D, which is 10 micrograms when you're pregnant. We've talked about vitamin D, which brings us to the next important supplement, which is calcium. So calcium is very important. It helps to build the bones of your baby, the nerves, muscles, helps with circulation as well. So the recommended dose of calcium that you need is about 1000 milligrams of calcium. There are different sources of calcium, like your dairy. So the dairy products are a very good source of calcium, okay? But for people that are vegetarians that may not take dairy products, there are other fortified dairy alternatives that you can take, like the soy milk, the almond milk, and other plant-based milk that you can take, to be enriched with calcium, okay? So that is for the diet supply of calcium. But you also take the recommended dose, like I said earlier, of calcium when you're pregnant, and its importance I've listed out. So studies have also shown that taking calcium in pregnancy would also reduce your risk of having preeclampsia. So preeclampsia is a pregnancy specific condition that causes hypertension and protein in your urine, and this condition can be very dangerous, okay? It can cause having premature birth. It can also cause having eclampsia, which is developing seizures in pregnancy, and also cause organ failure as well. So when you take calcium, it will reduce your risk of having these complications. The next point would be your omega-3 fatty acids. So these are polyunsaturated fatty acids that are very important for health and development of your baby. So they help with the development of the brain, eyes, nerves, central nervous system of the baby. Okay, so you're expected to take this omega-3 fatty acids because they are very important for you and your child. And I would also point out that you should avoid cod liver oil or any supplements that contain vitamin A, because taking these supplements that contain vitamin A can actually be harmful to your baby. It has a harmful effect on the child, which nobody would want. The last supplement here will be vitamin C, which is ascorbic acid. So ascorbic acid would help support the growth and development of your child, and also build the immune system of the child. Okay, so that brings us to the end of this video. If this video was a helpful one, don't forget to like, comment, and subscribe to my channel, and I'll be seeing you. Bye.